We are organized to be out here because we want freedom of choice with the vaccine. It has not stood the test of time as all the other vaccines we take and give our children have. We need more time, we need more research. None of these vaccine companies have liability. So if you develop a health problem, and many people have, you are on your own medically. Nobody's going to come in with a $200,000 check to pay your medical bill or your time off work if there's a problem with the vaccine.
So when COVID was pretty bad, I got my vaccine December 23rd, 2020, and I was in the ED like less than a week later. I ended up having extreme left arm pain and shoulder pain, which turned into adhesive capsulitis where my shoulder was frozen. So I had to get a steroid shot eventually to free that up. I've had all kinds of heart problems with fast heart rate, high blood pressure. I'm dealing with some peripheral neuropathy in my hands. But yeah, so I got hurt. They denied me workers' compensation because even though they had encouraged it and pushed it and said that it was safe, but they denied me workers' comp because it is a quote-unquote voluntary vaccination up until, I guess, a week ago when they made it mandatory to get it by September 21st by 10 a.m., otherwise you'll get terminated.
Not to get the vaccine just doesn't make any sense to me. And working in a hospital without being vaccinated doesn't make any sense to me because you're just exposing people to getting sick. And I feel that the freedom, people saying their freedom's being taken away, but I feel that freedom is when you're affecting the community with this freedom, and that's just not right, So I feel like freedom is getting the vaccine, and we can go back to a normal life.
I was working as a triage nurse, so I was actually working throughout a lot of it. And why aren't we teaching people that you need to be out in the sun, you need to get vitamin D, you need vitamin C, you need to be well rested, you need to take fruits and vegetables. And when we tell people that, there is a pushback, even within the medical community. When I worked in Texas, there was a doctor that was sued